Welcome. Thank you to the Apprenticeship Employment Network for hosting the National Skills Week Industry Workshop. Never before has skills reform been more critical to our nation. Ensuring our workforce has the skills we need for the jobs of the future is critical for rebuilding our economy, especially in the post-COVID environment. Collaboration between government, industry and the community will be vital to the success of our recovery. And it goes without saying that the Morrison government is committed to supporting Australians to stay and work. However, we also need Australians better trained for the jobs needed. And to do that, we need real reform when it comes to skills training in Australia. So we have prioritised skills development as part of the JobMaker strategy, which is designed to set Australia up for the economic success over the next 3 to 5 years. Our multi-billion skills package provides a significant boost to the vet sector. This includes our supporting apprentices and trainees wage subsidy that is providing timely, targeted and scalable support to businesses to keep on their existing apprentices and trainees. This builds on the establishment of the National Careers Institute and the National Skills Commission. These two organisations are working together to strengthen, streamline and improve the delivery of and access to careers information in Australia. Again, I'd like to thank the Apprenticeship Employment Network for hosting this industry workshop, and I hope that you enjoyed today's session. Thanks.
So thanks for having me, everybody, and I might just start off by just introducing Orygen, as I'm not sure if people have heard of us before, and a lot of people seem to get us mixed up with the energy company all the time. So I'll just talk a little bit about who Orygen are and just explain what we're all about. So Orygen is basically Australia's largest youth mental health research centre, and we're the National Centre of Excellence in Youth Mental Health. So it's basically where Headspace originated, where that Headspace model originated, and also where the EPIC, so Early Psychosis Prevention and Intervention Centre. So that's where that clinical model of care was developed as well, and that's quite well known in the mental health sort of sector and space. And we basically have 4 main components. So we have our research centre, and that's through a partnership with the University of Melbourne. We also deliver clinical mental health services across the west and the northwest of Melbourne, and that's through we have 5 Headspace centres that we run. And we also have a tertiary youth mental health service for more complex and severe mental health presentations. And through that service in the west and northwest, we service about 6,000 to 8,000 young people per year who are experiencing sort of more severe and complex mental health, severe and complex mental illness. And so that's who we are. In addition to that, we do have our policy think tank. And so that's quite a big part of our organisation now. So we provide advice. We work with our research team and we provide advice to government, federal and state governments. We also have a large training department. And so we create a lot of youth mental health resources and deliver a lot of training both within Australia and internationally. You might know our Executive Director, so Patrick McGorry, or Professor Patrick McGorry, I should say. He's our Executive Director, and so he was Australian of the Year in 2010. And I'm not sure if people saw, he was on Four Corners on Monday night talking about some advocacy, doing some advocacy and talking through the lack of mental health funding available for people experiencing complex mental ill health. So that's who we are. And I guess with today's presentation, what I thought I would do is I'd sort of start by setting the scene a little and just explain some of the current sort of state of play, I guess, in Australia, especially with COVID and what's sort of happening in the mental health sort of space. And then just take you through, I guess, some of the common signs and symptoms and maybe some of the things you might be noticing a bit more of in your work with young people, particularly since the pandemic began in sort of earlier this year. And then, I mean, my sort of background is in education and employment, so I will talk a little bit about how that has had an effect on that, and I'm probably sure all of you have had lots of young people talking to you about some of the challenges now that we're, especially in Melbourne with lockdown, and the effect that's had on their employment and their education. and then take you through some information that might actually be useful for you going forward. And then I'll just talk about some of our mental health projects, our employment and education projects that we have underway, and just give you some information on some resources that might be useful for you in your work. So I'm not sure if people have seen this, and Ian Hickey was in the news as well, Professor Ian Hickey, talking about some modelling that we've done at Orygen. But it's not great news, but it's pretty much the modelling that they've undertaken is sort of presented that we're probably going to see about a 30% increase in common mental health issues in young people as a result of the sort of impact of the coronavirus. And I guess just to put that in context, we're sort of expecting an additional 82,000 young Victorians to experience mental health disorders as a result of the pandemic. So it's not good news, but we're trying to put some sort of, we're putting some plans in place, obviously, and lots of advocacy to try to increase support to meet the demand that's going to come as a result of this. I just thought I'd talk briefly, and because I'm not sure how much people know about the mental health care system in Australia and what that's actually like, and I won't go into too much detail, but just sort of a general sort of feel about what that looks like. So the basic, we have two sort of lines of care. It's primary care in Australia. So that's when you go to your GP and you get a what they call it's part of the mental health, you get a mental health care plan, and your GP refers you and you go and see a psychologist, and that's subsidised through Medicare's Better Access Initiative. And usually what that is clinicians working on a sessional basis. So you might go and see someone for an hour a month or an hour every 2 months and work with them on your mental health. And clients at the moment, you can access up to 10 sessions per calendar year through that system. So that's your private psychologists, headspace centres, those kind of situations. There's also what we call specialist services, or sometimes referred to as tertiary mental health services. And that's where people with more severe and complex mental illnesses seek treatment. Those services are generally managed by hospitals. They're free, so they're funded by the state governments as part of the hospital system, and they provide really intensive support. So lots of people are usually getting case management support, and they often have group programs that people with mental health conditions can participate in those group programs. Lots around psychosocial recovery, employment, education, those kind of programs. You might have all heard of Headspace, and I know I've mentioned it earlier, but in terms of young people, Headspace is the sort of one of the main providers of mental health support. And with Headspace centres, you can see a GP, so young people can go in there. The idea is it's not as stigmatising. You can go in, you can see a GP, you can get your mental health care plan, and you can go to see a psychologist or a clinician in the same setting. They also have what we call peer support workers on staff. Usually they might have some vocational workers supporting young people with their work and study goals, and a whole bunch of other people running groups and things like that. I'm not sure if everyone knows as well that Headspace have an online version. It's called eHeadspace, and so they provide counselling for free on chat or on the phone. But eHeadspace actually has a digital work and study arm of it as well, which is quite large. So if you are seeing young people and they are starting to experience difficulties with their work or study, they can also seek advice and seek career counselling online through eHeadspace's digital work and study platform. So please tell anyone that needs that kind of support, they can access that. So in terms of though with COVID, obviously we do need to think about additional sort of mental health support, and the government's actually been really on top of this and moved quite quickly to respond to the mental health needs of people in Australia with COVID. So one of the first things they've done is they've increased, they've given another 10 additional Medicare sessions for people that are impacted by the second wave of coronavirus. So that's generally in Victoria, but now instead of just having your 6 to 10 sessions, you can get an extra 10 sessions, which is fantastic. In terms of telehealth, so now telehealth sessions, they've been added to the Medicare items. So clinicians can actually provide telehealth sessions to people now and claim that back. So that's that's something that's been really, we've been trying to get that in the mental health sector for years, and so that's been a really positive thing that's happened, so that people can get support remotely at any time, as long as they can find a clinician that provides that support. There's been extra funding given to Beyond Blue, so now there's a 24/7 coronavirus mental health and wellbeing support line. So there's online and phone chat that's run through Beyond Blue. And there's been increases in funding, obviously, to Lifeline, Headspace and Kids Helpline. So all of those platforms have got additional funding and resourcing, and so they've got a lot more people working and supporting people. And just in terms of us, Orygen Digital have recently been given quite a significant amount of funding to roll out what we call moderated online social therapy into all Victorian youth mental health services as well. So that's been really fantastic to get that program up and running. So in terms of, I get asked this question all the time, so what causes mental health difficulties? And it's just a really, there's no easy answer to this. So it can be a combination of all of these things. And I guess what's important to remember that it's quite common, and people can and do recover from mental illness. There's lots and lots of people that are working, studying, functioning well, and they have ongoing mental health challenges. And so what we know at Orygen is that most mental health disorders start to begin to occur within the sort of early 15 to 25 age range. And so that's why we focus our research and our work on that sort of youth age bracket. And there's 1 in 5 young people will experience a depressive episode by the time they turn 18. So that's, you know, why we focus our work on that. So in terms of some of the common early warning signs, so these are some of the signs that you might notice in some of the young people that you're working with if they're starting to have a hard time with things. And this is these are some of the things. This is pre-COVID actually, but this is some things that you might have noticed, especially if you're supporting young people in apprenticeships or trades or traineeships. You might have seen a drop in their performance. Their employer might have rang you up and said, oh, look, he's not sort of coming in on time, or doesn't seem to be as motivated or interested as he used to be, or she, or they're just not turning up and not sort of seeming as happy, I guess, as what they usually were. So definite changes in mood, or noticeable less interest in what's going on. But I guess just it is also important to remember that mental health challenges can present in many different ways for people. So someone might show some of these signs, but others might just be their usual self and might not be so obvious. And I guess it's just about being more comfortable talking and asking the question and trying to unpack that for young people or for anyone. So I just thought I'd expand on some of the things that we've been noticing. Well, I guess the other sort of challenges with COVID. So, and I don't think this is just not young people, this is everybody, including, like, I think about myself, and these are some of the sort of big changes that have been happening over the last, since the start of the year, and some of the increased anxiety, distress. Lots of people are starting to, not stick to the usual routine, have difficulty concentrating. I've had people that I work with say they feel like they're operating at 20% less than they usually do since the COVID virus. There's lots of people focusing on the news stories and getting caught up in, watching every single Dan Andrews announcement, or Mark McGowan, or whoever it might be in your state, and changes in diet. So all of those kind of things. Whoops, I clicked too quickly. All of these things are kind of, I guess it's a collective feeling of all of this is going on for everybody. So some of these things, you might be dealing with some of these challenges yourself, and then noticing that the young people that you're supporting and working with are also experiencing a lot of these things. So I'll just sort of move to education and employment quickly. And I guess in terms of COVID and unemployment, and I think none of this would be a shock to any of you, but obviously the national unemployment rate sort of crept up to 7.4%. And what we're noticing with youth unemployment is there's been a really big spike, and obviously we're sort of sitting around that 16% since COVID sort of hit, especially since March, whenever all the lockdowns started. But what we obviously know is that a lot of these numbers are probably likely to be a lot higher, and the rates of underemployment are obviously increasing rapidly as well. So lots of young people getting their hours cut down, or being put on casual contracts, or just not having any work but still technically being employed with the JobKeeper program. And I guess what we know from our work is that young people with mental illness are usually experience 2 to 3 times the rate of unemployment as other young people. So when we see these sort of 16% rates, we're thinking 2 to 3 times the unemployment rate for young people with mental ill health. So just, I guess, as an example, in our Orygen sort of clinics, we have, in our Headspace clinics, we have roughly, this is pre-COVID, there was about 30% rates of NEET presentate, so young people that are not engaged in employment, education or training in our Headspace centres, and in our specialised clinics, roughly about 60% of young people. And so our worry is that these young people are often the last young people to return to work in tough economic times. So we're quite worried about that group and those guys reconnecting into work. I guess though, lots of people, I just want to just sort of show this demonstration of, this is what we call a stress bucket in mental health. They use this in mental health to sort of talk through how stress, I guess how sort of stressful things. I guess basically what I'm trying to say is some people think that work is something that causes people, especially those people who are experiencing mental illness, to feel more stressed. So they tend to say don't work and take more time off and that kind of thing. But I guess this sort of just is to demonstrate that work, these are the kind of stresses from being unemployed that young people face. And so that lack of finances, having to deal with Centrelink, increase in smoking and drinking, just being generally quite bored, loss of identity and just unable to plan. And quite often that leads to a lot of stress and things tipping over when all of these things add up together. And what work does is basically, I guess for this illustration, it sort of drills holes in the buckets and it alleviates some of those stresses that young people might be experiencing. And so obviously there's lots of value in having a job, and that's just the same for people with mental illness. So this is a very important time for young people. In terms of young people's career concerns, so I was just looking at some things from pre-COVID, and this is from 2015, and this is something that BDO did, and they asked young people what were some of their career concerns. And so young people, a large number, they were concerned about getting a career-related job in the current economic environment. That 30% didn't know what career path they wanted to take. And then half of young people didn't think their chances of getting something after uni were very strong. But I guess, like, as I was reading these slides and putting these slides together today, I did start to look at this one and that previous one and start to think, actually, optimistically, I do think young people are probably really better prepared for this situation than we might think. And just thinking about that sort of portfolio careers, kind of how they have to manage a portfolio of careers really these days, and have been for the last sort of 5 to 10 years, and having to, we've got lots of young people that have got, part-time work, they study online, they might volunteer, they might do an internship. So they're kind of used to adapting and being flexible. And so hoping that takes them well into a post-COVID sort of environment and managing those changes. So in terms of what you can do in terms of employment support, if you're supporting young people in their apprenticeships or traineeships, because I'm sure all of you know this already, but knowing what's out there and how to refer, so in terms of those income support wage subs and all the mental health services as well that are out there to support young people. I think it's really important to keep the positive stories coming in. I think that really helps young people to stay motivated and feel hopeful. So if there are sort of young people that you're working with that have found that their work's continued or they've found other opportunities, sharing those stories with other young people is a really good thing to do. I guess continuing to support professional development for young people that are interested, so not forcing it on young people, but those young people that are, interested in looking at doing some, if there's online training or some short courses or things they can engage in while everything's sort of changed, and supporting those young people to participate in those opportunities. So good. I would encourage everybody to do some advocacy and get involved. So speak to government, employers, TAFEs, industry bodies, all of those kind of people. Just keep this front and centre that this is really important and that young people's employment is important. And obviously you're all doing that, but the more you can stay involved, the better. And what we try to do at Orygen is involve young people in any of the programs and planning and research that we do, and just to understand actually from them what would work for them. So try to, if it's running focus groups or surveys or bringing young people onto your boards or meetings, and just asking, what do you think would help get you through this stage? And I guess just keeping in mind that the pace has changed, but young people are still working towards their career goals and they're quite resilient, and so they do want to keep sort of seeing what's out there and moving forward. In terms of mental health, what you can do, I would encourage you to learn the mental health basics. So if you can do mental health first aid or some other kind of training, or I think that would be amazing, because that can be just give you the confidence to really talk about that to the young people that you're working with, or your friends or whoever it might be. In terms of just being clear with boundaries and saying, I'm not an expert, but I'd like to help, and just having those conversations and asking people if they're okay. And just again reiterating, try to have some resources and referral pathways open to you. So just knowing who your local services are, who you can refer to, and what you need to know to be able to get young people into those services. And of course, make sure you look after yourself, because it can be tricky and hard sometimes to talk about mental health. So making sure that you are taking the time that you need to debrief with your team. In terms of what about your workplace, so might not be so relevant at the moment if you're in lockdown like me, but I guess just thinking if, once you're going back to work, thinking about the language that you might use in your workplace. Sometimes we might use slang or talk about things and say, oh, that person's crazy, or that kind of stuff. Just sort of thinking about how that might kind of might be perceived, I guess, by a young person that might be experiencing some mental health challenges, and thinking some small changes around that might be really helpful and open up conversations. I guess asking for mental health training as part of your induction, and talking to your employer if that's not part of your induction process, or if you don't have access to that as part of your employment, maybe that's something they need to think about. Reassure young people and your co-workers that if they do need time off for counselling, or remind them about their EAP. I think a lot of young people we work with, even the ones that are working for the really big companies like Coles and Woolworths and those, they actually just don't even realise they've got EAP available to them. So it's just reminding young people that that's an opportunity as well to get some help. If you can offer flexible work hours, I think it sounds like the world's going to change a little bit after COVID, and people are going to look at, we can do things online, we can do things via Zoom. So there might be some changes that you can introduce off the back of COVID to make things a little bit easier for people that might be struggling a little bit. I guess that bottom point there as well is just thinking, responding to mental ill health as you would to a physical illness. So if someone calls in sick and says, I'm struggling a bit with my mental health, not being weird about that. And it's just like someone ringing up and saying, oh, I've got gastro or whatever it might be, and I need a day off. It's just being, treating everybody the same in terms of what might be happening for them. And so we asked some of the young people that were, some of the peer workers that worked in our Jobs Victoria employment project, and what they sort of thought, what their thoughts were. And I guess they you know, they said things like highlight failure is not a bad thing. And there are many versions of success. Treat young people with mental health challenges the same respect as those without, and just continue to support people into meaningful careers. Refer to clinical support if you need to, but supporting young people back to independence. And I guess, you know, treating people like anyone else. Just because someone has a mental health challenge, they don't want to be treated like, generally don't want you to take on a parental kind of role or smother them. It's more about guiding them and providing some clarity, and still giving that young person, I guess, the dignity to make their own decisions, and have some control over what's happening for them. So, in terms of where to get help for young people, so I've mentioned eHeadspace and the online counselling and the employee assistance program. It is a bit overwhelming, the amount of services out there. So one of the best sort of websites that you could look at is the Head to Health website. That's basically got all of the different services in the one spot, and you can search under youth, you can search under whatever it is that you need, and that will give you the information and resources that you'll need to be able to access services. I guess it's also important to remember to reach, especially with apprentices, talk to the TAFEs, talk to their student services officers and see what they can do to support people. And I guess in terms of their actual career, thinking about, you know, there are career development services around as well that people can access, and referring to those. I guess one of the things is we don't want to forget about you and looking after yourself, because it is really tough at the moment for everybody, and all of us that are still supporting other people, it can be really hard managing, you know, things that are going on in your own life as well, and the anxiety around COVID. So these are just some sort of general tips about how you can look after yourself, and this is something our management team have been asking us to think about. But just, I guess, sticking to a routine if you can, as much as you can. I mean, I know it's really hard at the moment. This is one of my personal favourites. It's just limit time on Zoom. I feel like, you know, at the start of COVID, everybody was quite excited about the idea of Zoom or, you know, GoToMeeting, whatever it is. But I think it can have its limits, and it can be very draining. So just limiting that. If you can exercise and get some fresh air, get outside. I think it's, you know, some of these apps that you can use to keep track of things, and, you know, maybe, you know, if you've been struggling with motivation and struggling to get outside and do that exercise each day, that can be really helpful to motivate you. And I guess this is something as well that I've sort of taken on board, as I've just started taking a break from watching news about COVID, because it is quite anxiety provoking, and just maybe, you know, having one sort of lot of news a day or something like that, rather than just constantly refreshing your Twitter feed or going over and over the numbers. And I guess remember, it is quite normal to feel sad, distressed, worried, angry, all of those kind of things. I think a lot of people would probably be experiencing a whole range of these sort of emotions over the last couple of months. And so just a reminder to just talk to people and talk to people you trust about that sort of stuff. And I've just put there on the side of, you know, there is Lifeline, there is your GP, there is your EAP. So just reminding you all to take care of yourself as well. So I'll just talk a little bit about what we're doing, Orygen, at the moment in this space. So in terms of employment and education projects specifically, so we have a few different sort of things that we focus on at the moment. We have the individuals placement and support model. That's basically, it's having career counsellors or vocational specialists built into clinical mental health teams. So we have that. We've advocated for that to be funded in Headspace across the country, and so that's in 25 Headspace centres, but we also have that in our tertiary mental health services in Melbourne. But that's something that we're trying to get into all youth mental health services, so that young people with mental illness have got professional career support that's right there when they need it, and early. So instead of waiting until they've finished their treatment, they can get that sort of support while they're getting treated for their mental health. We have developed an online career support platform called YOTS, and we've tested that, and that's to provide additional support in an online sort of format to young people experiencing mental illness. We do have peer workforces. So peer workforces, they're basically young people with lived experience of mental ill health, and they support other service users by sharing their own lived experience with other young people. And that might be about sharing their lived experience of having a job and disclosing their mental health to their employer, or it could be just talking about what it's like to come to a mental health service and what that experience might be like to talk to a clinician or take medication for mental health, those kind of things. We are doing some work with the university sector at the moment as well. So we've got a university mental health framework project that you might have seen some information about. That's just about finished, and so that will be available probably in October. And that was so that's a framework to sort of help universities to implement supports for students coming into those campuses. And we also have been doing some work with international students, and we did an international student mental health consultation. So talking to the sector, the education sector across Australia about how they're supporting the mental health and wellbeing of international students, because we obviously that group as well is quite, has been affected quite a lot by the COVID virus, not being able to access any of the job seeker sort of supports that other young people can access in Australia. And specifically in relation to the apprenticeship sector though, this is a fairly new piece of work. So our policy think tank have been in talks with the Department of Health, and they've agreed to us developing a piece of policy advice on apprenticeships and mental health. And so that's going to be a policy brief and a policy paper, and that will be due for completion in early 2021. So we would really love to hear from the sector and yourselves about that, and I'll just take you through a little bit more what that will look like. So obviously they'll be looking at the state of youth unemployment and the impact of that on young people, a little bit about apprenticeships and sort of building a bit of a sort of case for what the apprenticeship sector currently looks like, how that impacts on young people's mental health, and is there any sort of negative impact, those kind of questions in there, and what kind of supports are available for apprentices and trainees. So, you know, some of the mentoring programs that you have available, what the TAFEs are doing to support, or the trade centres are doing to support young people in apprenticeships. So we're quite excited about that. We're quite excited to work with the sector on that piece of work, and that's underway at the moment. In terms of the broader sector, so mental health land, I guess, and other sort of things that might be of interest. So the Productivity Commission report, the interim report, was very positive towards IPS and peer work programs, and that report should be out more publicly over the next month or two. The Victorian Royal Commission into Mental Health, that's also underway, and that's been very strong indications that peer workforces need to grow. There was recently in Victoria an inquiry into sustainable employment for disadvantaged job seekers, and that had some really good recommendations if people wanted to have a read of that. There has been a freeze, like in Victoria, there has been a set for in mental health peer work, so that's been added to the free TAFE list, which is quite exciting. So that means obviously there is a demand, or an increasing demand, for qualified peer workers in our space. And I guess in terms of this this apprenticeships and traineeships kind of area, we're quite excited to, I guess, understand how we could, that new workforce, we could develop sort of a traineeship pathway and work with the group training providers or other sort of mental health employers to bring more of those opportunities to young people with mental ill health, because that's a very exciting development in our area of work. And there's also, potentially you would have seen this week, the National Youth Commission for Australia, they launched their inquiry into youth employment and transition. So that's got some really good recommendations around mental health and young people and work and study and all sorts of things. So you can read that one as well. Some of our policy and advocacy work, so we do, we've done a little bit, well, quite a bit actually, so on tertiary education we've done a report on the university sector, but we've also done some analysis of the employment services sector as well. And one of our bigger reports was that Talbot Management report that was a couple of years ago that initiated quite some big changes in, as particularly related to that IPS program I spoke about earlier. In terms of training though and resources, we have a whole lot of stuff on our website that's free, and we have lots of fact sheets that you can download. So if you are after any training or any sort of resources that will help you working with the young people that you work with, just go onto our website, look at our training resources or at any of our fact sheets, and we've got a ton of stuff in there. There's also a load of webinars and things that you can do, and online learning if you want to. We also have a lot of COVID specific resources as well. So if you are after a bit of information and some downloads that you can just give to young people or give to employers that you're working with that are worried about how to support the young people they've got employed in their apprenticeships, we've got a whole bunch of stuff on work and study and self-care and tips for people supporting young people during COVID-19. And so that's probably it from me. I think I finished a little bit early, but hopefully I can answer any questions if anyone's got any, or if there's anything you'd like to know about Orygen or how we could maybe be, if there's anything that would be helpful for you in terms of our work.
That's great. Thank you, Gina. I know it's difficult to present for 40 minutes or so with no audience when you're just talking to your screen, so thanks for doing that today. We've got a little bit of time, so if anyone wants to turn their microphone on and ask any specific questions, we can do that, or we've got the chat room, you can type in a question. We'll also be able to share this presentation for people if they want further information, they can get it from the presentation directly. Any questions? Look at that. Geez, everyone's really shy on video conferencing sessions. All right, well, with that, look, again, Gina, thanks for making the time and effort today. That was great. You do some fantastic work there at Orygen. We'd be keen to work with you on the impacts and the effects that we're seeing on the ground with apprentices and trainees more specifically. So happy to work with you on that. I see someone has turned on their microphone. I've got Brett Lee there. Hi, good morning, or good afternoon, Brett.
I did, thank you for the presentation. That was great. I did notice that you spoke about supporting, you mentioned supporting the young people to access mental health clinical support if needed. When you're talking about that was like something that young people themselves have sort of voiced as something that they would like to see. So support to seek clinical support if needed. Is that something that you could elaborate on like, I guess, like how to go about that? I've done it, with some of the trainees that I work with as a mentor, but I'd love to hear about what your thoughts are and best ways to go about that.
Yeah, I think it's being, I guess it's being really honest and saying, like when I used to work, I guess, with young people myself, I'd be really upfront and say, look, I've noticed some changes. I've noticed some changes in you. You just don't seem to be, perhaps, you might have noticed that they haven't come into work as much, or they might be not sort of lapses in concentration. I think young people particularly, I think they would prefer people to be honest and upfront and just sort of say, look, I've noticed some changes, can we have a chat about that? Would you like some support linking in with some help, or, would you just like to have a chat about that, and feeling comfortable and confident to have that conversation. But then also, following through on that conversations, so not just sort of leaving it and not coming, you know, not checking in later and just sort of saying, oh, you know, I know that was probably a bit unusual for me to bring that up with you, but I was just wondering how you were feeling today, or whether you'd need some help with linking in, or if you've managed to have a chat to your friends or family or supports about some of the things that might be worrying you.
I've found that most of my trainees are really open to the idea of getting support, but I think at the moment the services are really, it's really difficult to actually access counselling and psychology appointments.
Yeah, and it absolutely is, and that's we recognise that absolutely. There's huge, well, there's been such a huge increase in demand in our sector, and unfortunately, getting the workforce in time to meet that sort of massive increase in demand has been very tricky. But we'd like to hear from you though, if that is becoming, you know, if you are experiencing those problems, then let us know, because that's our job to find out why that's happening and what, you know, what we can do about that. You know, if you're finding that, you know, it could just be something that, you know, that's, well, it won't be small, but it could be something that we can maybe do something about and try to direct some funding into services that are, you know, if there's a really high demand in certain areas, talking to people about why and what we can do to alleviate that blockage. But yeah, we definitely, mental health is probably one of the most underfunded areas of healthcare there is, and this pandemic has really kind of brought to light how underfunded it is in this country. And fortunately that both sides of government have really actively, you know, they're putting more money and funding into it right now, but yeah, we've just got to kind of catch up and adapt as a workforce in mental health as well to try to meet the demand.
Thank you.
It's okay. Fabulous. Well, thanks for having me, Gary. It was great to talk to everybody. I can't see anyone, so it's a bit different, but thanks everyone for attending. And if you do have any questions or you'd like to know more about our policy paper on apprenticeship mental health support, yeah, please stay in touch. And Gary and Nick have both got my email and information as well. So,
yeah. Gina, I think we did have one more question sneak in just then. What options are there for individuals having familial relationship issues? Are there specific organisations for, organisations or services?
Yes, there will be. I just don't know off the top of my head, but I can send that information through. That's helpful. But that Head for Health website, that will have all of those, so you can search on there for family sort of mental health support, or family and carers, particularly youth, aged, everything will be on there.
Great. All right. Well, thanks again, Gina, and thanks again, everyone, for attending.